Hey, good morning and welcome to another briefing on COVID-19 for law enforcement, brought to you by the Legal and Liability Risk Management Institute. These briefings are an attempt to share information for law enforcement, particularly for officers who may not have time because of the ongoing emergency to actually look at some of the things that are being put out by the Center for Disease Control, or even to share information among law enforcement agencies. So we put some short briefings together. The briefing number one was on operations and limiting operations to limit exposure to very serious events. I want to talk in this briefing simply about the CDC's recommendations for law enforcement, because CDC has put out some recommendations for law enforcement where they actually take the time to identify, what COVID-19 is. One of the things that is first noted is just a general outline that, based on current data, that symptoms may appear in as few as 2 days in some people and as long as 14 days after exposure to others. So that's why, as we see law enforcement officers potentially being exposed, that's why there's this 14-day quarantine that is being suggested, because you could actually be carrying the virus for a long period of time before it actually begins to show symptoms. Some of the symptoms that the CDC is identifying is a fever, cough, difficulty breathing, or shortness of breath. And again, that's what they're finding is typical in these cases. So again, it is thought to spread mainly from person to person, which is why all of the suggestions for law enforcement related to hygiene, related to cleaning off your equipment, cleaning your workspace, all of that becomes very, very important. One of the other things is, and we mentioned this in the operationals briefing, is that the CDC is recommending that there be this 6-foot distance between persons when that's possible. Now, we have to recognize in our business that that's not always possible. Sometimes people have to be arrested. Certainly you have to restrain them. You may end up having to go hands-on with somebody in a force situation. So there are times where we're not going to be able to maintain that. But, from our standpoint, it's not social distancing. It really is an occupational distancing. So when there is the ability to do it, perhaps interviewing somebody or something like that, we should do it from 6 feet away at least, so that there's not the possibility. Some people, even when they talk, they're spitters by accident because they're excited. That's the kind of contact that we want to avoid of any sort. Respiratory droplets, all of that is recognized by the CDC. So again, if possible, we want to maintain a distance of 6 feet. And the other thing that the CDC is strongly recommending for law enforcement is wash your hands on a regular basis with soap and water for at least 20 seconds. And if soap and water aren't available and drugs aren't suspected to be present, on your hands, use an alcohol-based sanitizer with at least 60% alcohol. There's a lot of knockoffs and whatnot out there, so we do want to be careful. We don't want to be using something that's not going to work. So, and again, the other big piece is don't touch your face before you wash your hands. The thought process is, this could be spread into the eyes, the nose, or the mouth. So, and again, the eyes, depending on who you're looking at, is what you'll see. But you notice that there is suggestions for certain equipment, and that equipment does include, eye protection. The reason is because any of those eyes, nose, mouth is a possibility. To the extent that the resources are available, the CDC is recommending that law enforcement have, at minimum, disposable examination gloves, disposable isolation gown or single-use disposable coveralls, a particulate respirator, N95 or higher, face masks is an acceptable alternative. So these are the things that we should have in our kit. and eye protection that fully covers the front and sides of the face. So even those sometimes we see that painters use that do have the side bearings. Glasses are not going to be enough. Hey, even the CDC recommendations recognizes that because of the duty belt and gear, you might not be able to wear coveralls at all times. So, it's highly recommended that you regularly disinfect your duty belt, and certainly disinfect your duty belt after coming into contact with anybody. There's a lot of potential spots and nooks and crannies on that duty belt that could hold this particular virus and hold it for a period of time. One of the things that I see being recommended by officers, this is not in the CDC stuff, is that they're actually not taking their uniform into their house after getting off duty. They're changing a hallway. They're changing right outside the door. They're dropping it in some kind of a plastic bag that they leave there, and so that they're not carrying potential germs into the house on their gear or their uniforms. So again, you want to also, the CDC points out, avoid shaking your clothes out. Probably many of you have been into a house at some point in time where you've felt that there was bugs or cockroaches or what have you, and when you look at that and you think about that, I used to shake my feet and my legs. Well, certainly they're saying that you don't want to do that in the case of this particular virus, because you could actually be shaking germs into the environment. So again, these are the things that are listed. We are going to have other briefings. Again, we're going to try to keep them short, but certainly you can go on the CDC's website and find the information related to guidance for law enforcement. It is suggested that law enforcement does follow the interim guidance for EMS if you believe that you're coming into contact with somebody and you have to make contact with somebody who's confirmed. So again, another piece that we will take a look at in one of these briefings. And again, some of our we are fortunate. Some of our local EMS has designated one rescue unit for just COVID-19 suspicion patients. Again, law enforcement could also make use of that if somebody had to be transported that you had that you suspected was COVID-19. And in fact, that's probably the best practice, is to let the medical professionals deal with that particular aspect with all of their equipment. So again, please be safe. We're going to continue these briefings as more information comes in. We're not going to just duplicate them for the sake of duplicating them or whatnot, but certainly as any more information comes in, as we learn more from law enforcement around the country, different ideas and whatnot, then we'll certainly bring that to you as well. Have a great day. Please be safe, and carry on the best we can. Again, limited operations, as we mentioned in briefing one. The less contacts, the less exposure. The less exposure, the more we keep you safe, so that you're there when needed for the most important work, when somebody is seriously threatened, seriously injured, or whatnot, where there is a real need to have law enforcement respond. We don't want law enforcement totally caught in quarantine when the needs arise for public safety. Have a great day, and again, be safe.